Those COVID cases once again starting to rise after hitting historic lows just a few weeks ago. Right now, we're joined by Dr. Dan Shirley to kind of break all this information down. So, of course, with China and Europe facing a spike in those COVID cases with the new Omicron subvariant, how soon, if we do we see a spike here in the U.S.?
Well, it's interesting, that we do see those cases rising in those countries, but, the situation might be slightly different in those countries as far as previous cases of Omicron and how much vaccination was happening in those countries compared to the US. If we look at prior surges, it was always a few weeks after those other countries had surges that we did. But of course, we're watching closely, and for now, things are staying pretty stable.
Right. And of course, we'll continue to keep everyone updated as soon as we do hear more. But of course, right now is the time where many are planning some trips, some vacations. What do you recommend when it comes down to traveling, wearing masks when you're not in a country that you're familiar with?
Yeah, or even a state or a county you're not familiar with. That's maybe the point, is if you're getting into a situation where you aren't sure about the situation, and you're going to be in close proximity, especially indoors to other people, you might want to consider taking and wearing a mask. And then the other big part of this is if you're either susceptible because of medical conditions or immunosuppression, or you're going to be around people who are susceptible. Those are definitely points where you might want to take a mask.
Yeah, and take into consideration what is a requirement there. So, of course, there's been some new reports about a fourth shot of the COVID-19 vaccine needed. Is this for a specific group of people?
Well, I think we're still trying to figure that out, actually. The studies that have been done so far showed some impact for susceptible people, especially people over a certain age. But as you know, because we aren't doing it, we don't quite know who the best population is for a fourth shot, or if anybody's going to need it. And even more importantly, when that might be needed. That obviously is tied to seeing a rise in cases or anticipating that in the near future.
And just just to clarify this here, do people who have had COVID in the past need that boost, whether or not it's the third or this potentially fourth vaccine?
Yeah, that's definitely a point of study and monitoring. I think there are some early data that suggests that getting Omicron after vaccination doesn't exactly lead to a robust protection. So we need a little bit more information about that to tell people. The other problem is, even for anybody that was infected, we never know how high of a level of immunity that ends up with, or how long it lasts.
All right, Dr. Dan Shirley there joining us. Thank you so much for spending a little bit of time.